Good afternoon, everybody. I'm going to start again today by just saying thank you so much to all of my new Turkish friends and hosts. And I also want to say thank you to Lena because she very kindly allowed me to switch with her for today, and she went first. And I hope that the reason that I requested that switch of Lena will become evident to you as I start to talk, because what I want to do now is embed the information about meal times in the information that Nina has given you, because an awful lot of the research that I've done with my friend Joanna, whose name is on the presentation today, is interprofessional and really has been a work in progress. Like Lena talked about, we constantly revise our expectations of each other, and we revise our goals, and we try and get along, and sometimes we do, and sometimes we don't. We have disagreements, we try and fix them and move on to the next thing. And so from my perspective, the interprofessional collaboration has been, with Joanna particularly, has been amazing. And so that's why I'm second and Lena went first. And thank you, Lena, I do appreciate it. So today what I'd like to do is I want to talk to you about 4 areas for promoting mealtime participation in children with autism spectrum disorders. And of course, this isn't particular to children with autism spectrum disorders. This is for any child who is a picky eater. I just happen to have done the research for children with autism spectrum disorders. And I would also like to talk to you about how to facilitate parent empowerment to improve mealtime participation. Because really, as Lena has mentioned, mealtimes are really need to be part of an interprofessional team collaboration in order for them to really work. So here's what we did. Here's what our mealtime team looked like. So there's me. And a little bit like Lena, my background is from all over everywhere. My bachelor's degree is actually in elementary education. So I started life as an elementary school teacher. I very quickly decided that was not for me. So I exited that profession and became a speech-language pathologist. I was always interested in working with children with challenging behavior, and as a speech-language pathologist realized, I don't have the tools to work with these children who have very challenging behaviors. So I went back and I did a second master's degree in applied behavior analysis. And then I became a board-certified behavior analyst. And then I've always wanted a Ph.D., you know, might as well collect degrees, right? And so I went and did a Ph.D. in special education. So all of my education, while it is related, it's in similar fields, it's very specific, and my PhD is specifically in evidence-based practice in special education. I collaborated with the parents and the child. You can't have an interprofessional team working with a child unless the parents are at the center of the team. Joanna, my research colleague, also has a PhD in special education, but she is an occupational therapist. And so she has a very different perspective on how things should go when you're working with the family. And she really, really understood family systems. And that is not something that I had ever really understood as either a speech-language pathologist or a behavior analyst. It's not something that we get education on. So Joanna brought that richness to our interprofessional team. And then the other professionals that Lena mentioned and that I will mention here, Joanna recruited both SLPs, speech-language pathologists, and occupational therapists. I recruited registered behavior technicians. I hope you all remember, Nikki mentioned those professionals yesterday. They are people who are educated in behavior principles over the course of about a semester in the United States. And they were the people that I trained for the course of this research that I am sharing with you today. So that's what our mealtime team looked like. I want to point out, I mentioned this briefly yesterday, and I'm mentioning it again today. You cannot do many of the interventions that we want to do unless you recruit the parents. Parents will interact with their children way, way more on a daily basis than we will as professionals. In the area of mealtime difficulty specifically, parents will feed their children 5 or 6 times a day. And we have that opportunity maybe 1 time a day or 1 time a week, depending on what it is that you're doing in your professional role. Parents will see a greater rate of progress with their child. You will see decreased parent stress if you recruit the parent as an interventionist. And of course, parents can maintain regularity of routines that you cannot. So they can maintain a breakfast routine. They can maintain a lunchtime routine. They can offer snack if they need to. They maintain a dinner time routine. And those are really, really important things to understand as you try and do any intervention, but specifically in the context of what I am talking about in the terms of a mealtime intervention. So, Lena, hopefully you'll understand. You've seen this before, but hopefully you will understand now why I wanted to go behind you. I want to show you how Joanna and I took interprofessional collaboration and applied it to our specific research project. So the first thing we did was we got the SLP, that's me, right? And so my concern as an SLP is often about language disorders or speech sound disorders. So I come to the team saying, this is important. But then Joanna comes to the team saying, well, hold on a second. Your language isn't that important. We need to be more concerned about the child's sensory motor skills, or more concerned about his sensory processing differences. And then the behavior analysts come to the team. That's me again. And the behavior analyst said, well, no, we have to have a functional behavior assessment. This isn't going to work if we don't understand the function of the behavior. And we really like discrete trial training. Can we do some of that? And then, of course, as I mentioned, nothing happens without the parent and the child. And in this case, what does the parent bring to the situation? The parent brings their hopes and their dreams and their priorities for that child to the situation, right? We don't bring that as a professional. We bring our own baggage and our own knowledge. And as I mentioned yesterday, and I know Perrine mentioned yesterday in her introductory speech, parents are on a journey. These parents are going to be with their child way, way longer than we are. And so parents bring with them the history and the continuity of the child and the child's experience that we cannot, as professionals, appreciate. So as a result, we have this mishmash, right? We have this soupy mixture. Everybody's coming together. Everybody's got their own priority. But we need to step back from it for a second, and we need to say, where is the overlap? Where are we finding common ground? So instead of talking about speech sound disorders, as a professional, I'm going to talk about what are the language supports this child needs. We're going to talk about dynamic communication, the need possibly for some sensory-based communication system that will bridge the gap between the OT and the SLP, but will meet both of their needs. We're going to talk about outcomes, speech and language outcomes, because as Lena mentioned, at the end of the day, that's what we're here for. The ABA and OT people might talk about behavior supports or functional communication. The parent only cares about when will my child eat independently? When will my child hold the spoon? When will my child eat the banana, right? The parent wants the functional outcomes. The parent doesn't care about all these other things that we bring to the situation. And so what we're really looking for with all of these things, graphic communication, socially valid functional behavior outcomes, social participation, communication, functional outcomes, we're looking for speech and language outcomes. We want it all. And the only way we can have it all is, as Lena has mentioned, is by using an interprofessional collaboration for improved child outcomes. It's the only way it works. As the SLP, I cannot do this independently. As the OT, Joanna couldn't do it independently. We recognized our limitations, we put our heads together, and we came up with this intervention plan that I'm going to share with you today. So, having said all that, I now want to tell you what the goals are that sometimes can be very discipline specific. What are our goals? What are the outcomes that we want for children when we undertake a behavior change in feeding? The things that we really care about and that parents care about are things like adequate nutrition and hydration. So children who have very restricted diets, while they might be growing and they're at an appropriate weight, may not be getting the specific nutrients that their brains require in order to help them learn. We want children to develop age-appropriate feeding skills. So if it's appropriate for a child to eat from a spoon independently when he is 2, then that's what we want. We want to meet the individual needs of the child, not just the parent, but the child. We want to consider the whole child within the context of his or her environment. So we need to step back from our agenda and say, what does this house look like? What does this kitchen look like? What is mom dealing with as she is trying to feed her child? And we want to educate, train, and work collaboratively with individuals who are responsible for the development of the child in their system, right? So what I've tried to do here is go from specific to broad. So a specific hydration nutrition goal to a broad goal of family systems. So your outcomes have to cover everything. That's probably bad news, but you have to deal with it, right? Okay, what are then the importance of positive mealtime experiences? The first thing that's important is that we can maintain nutrition. As I mentioned, the second important thing is that we would be able to support the child's learning and behavior. The third really, really important thing is that we can ease caregiver stress. If you have ever worked with a child and his or her parent, and the parent spends their time running behind the child with a spoon, then you will know what I am talking about when I talk about caregiver stress. Parents find that very stressful. The fact that they cannot get their child to eat reflects, I think, on parents as if they were doing the wrong thing, that they're not a good enough parent, that they're unable to feed their child. And our research tells us that lots of parents feel that way, that they feel that they fail if they can't feed their child, and so they run behind them with the spoon. We want to promote positive family interactions at mealtimes, and as I mentioned, we want to empower caregivers. We want to take all of the information that we have, give it to the caregiver, and then step back. This is their job. Okay, so what works? That's what you're all here to find out, right? You all want to know what works. Environmental changes work, right? We know that if a child will only come to the table when there is an iPad at the table, that we should probably have the iPad at the table. Some simple antecedent behavioral changes are very helpful when we're trying to change behaviors. So environmental changes work. Food manipulation works. Cognitive and behavioral interventions work. Caregiver education works. And caregivers as interventionists also works. Okay, so let me talk to you a little bit more now about the interventions that will support some of these things that we know work. So what I'm going to do is try and break it down for you into 4 areas that we can address. And I will spend most of my time on the behavioral interventions because that's what we're here to learn. So the first thing I would like to mention is food characteristics. The physical environment, as I said, environmental manipulations work. The social environment and communication. So, food characteristics, things that you can do to food that will make it more likely that the child will accept the food. The first thing you can do is what's called food chaining. How many of you have heard of food chaining? 3, 4, that's it, 4? Okay, so now I'm here to tell you food chaining works, but only as part of a bigger plan. As a standalone intervention, it doesn't really work. I'll come back to that in 1 second. The other thing that works is attention to food characteristics. So that I was talking to somebody yesterday, I forget her name, she's from Ankara. Where are you? Are you here? Maybe she's gone back to Ankara already. I was talking to her yesterday. She was asking me questions about how to change the food that a child she is working with is eating. And I told her that one of the ways that you can change the food is by simply moving from pureed to mashed, right? You can't really go from pureed food all the way through to solid food, but you can change the characteristic ever so slightly by saying, I'm not going to puree this banana anymore, I'm only going to mash the banana, right? So that's what I'm talking about when I'm talking about food characteristics. You can work on things like changing the bite size or the number of bites that a child will take, and you can change the amount of food that you present. Right? So tiny amounts of foods and slowly increasing the amount of food over time. And of course you can change food characteristics by having the less preferred food in the environment. So the child has to get used to the idea that this food is going to be presented. So this is what food chaining is. And maybe if I show you the graphic, it'll be easier for you to grasp the idea. So here's a food chain, and this picture actually comes from the people who came up with food chaining in the first place. So if you Google food chaining, this is exactly what you will see if you Google it. So you start up here in the corner with French fries, and then you simply change one dimension of the food, right? And you have the child accept that one change in the dimension of the food. So now it's waffle fries. They're called tater tots in America. I have no idea if they exist even in Turkey, right? Or hash browns, which I know exist in Turkey because we had some for breakfast the other day, right? So, and then you change from here, once again, one dimension, to potato wedges. And then you move to baked, mashed potatoes with ground meat and gravy, and then hopefully in the end to something much more complex like chicken pot pie. I'm here to tell you this chain doesn't work, right? really the complexity of this chain for lots of the kids that we work with who have really challenging mealtime behaviors, this doesn't work. So the furthest I have gotten on this food chain is right here, to this point right here, where we were able to get the child from French fries to tater tots to home-baked chips. Okay, so the next thing was minimizing the physical environment, I'm sorry. So you're going to do things like minimizing distractions, make sure you have appropriate seating, which does not mean that the child is put into a high chair and strapped down. You can use timers for pacing. You can use different bowls or spoons, and as I mentioned yesterday, you put the preferred food into the less preferred utensil or bowl, and presentation of the food, which I already mentioned. The social environment, you're looking for functional communication. You're looking to make sure that the parent is maintaining a pleasant tone during the meal, that they're not providing cues like to the child, which is telling the child, don't eat that, that's yucky, right? And of course, you can change the social environment by making sure that there's great people in the room when the child is eating, people the child likes. And then the last one, the most important one for us here today, is about the cognitive and behavioral strategies. I'm not going to dwell on the ABCs of behavior. I hope that you took away the information from yesterday that I had on ABCs of behavior. What I'd like to do is to go through the other ones so that you have a sense of how these principles work in the mealtime plan that I'm talking about. So you'll probably remember that positive reinforcement is a consequence that's added after a behavior that makes the behavior stronger. So, here's a rat, and the rat is saying now, he has been so conditioned, he is saying, yes, I will press the lever for food. If you add that stimulus after the behavior, then it is going to continue to happen again in the future. How is this relevant to what I'm talking about? Preferred food following crying and refusal is positive reinforcement for crying and refusal. Attention provided following refusal is positive reinforcement for refusal. Attention provided following gagging or spitting is positive reinforcement for gagging and spitting. You getting the pattern here? Preferred food offered following an interaction with less preferred food is also positive reinforcement for less preferred food. Tokens offered following an interaction with the food, as I have mentioned yesterday, is also positive reinforcement for accepting an interaction with the less preferred food. And so what I'd like to do is show you what this looks like. So this is Connor. Connor is, and actually, once again, I do request that you don't video the videos and share them on social media. I have permission from the parents to use the videos, but I do not have permission from the parents to put them on social media. So if you don't mind, don't video the videos. Okay, so as you can see, this is me. This little girl right here is Connor's sister, Connor. And this is a graduate student in speech-language pathology, and she is doing the intervention. So, and this is, as I mentioned, we're manipulating the reinforcement as this video goes through. So here it is.
Here, Tom, that was a good job. We got 1 million on the board.
Babies don't get the gun toys.
Oh,
That's
no,
right.
Big boys
Guns
do.
are for boys. Yeah.
Yes. I like how you put that cheese up to your nose and then you put it on your tongue. What else are we gonna do?
He's eating cheese.
You tell me what you want to do so we can get 1 million on the board.
Check this out. This is the way mom operates, right? So if you do in mouth and spit, you can have 2 millions. If you do chomp and hold,
can have 4 minions.
Whoa.
Okay, so the interaction right now is an expectation for bite and spit. Don't be upset when you see that that's actually what he does.
Mom stacks the deck,
Let's see it.
right?
Okay, cheese.
Ooh. Oh, what are we doing here?
We have to either chomp and hold, or we're gonna put it, oh, was he putting it in his mouth?
In mouth and spit.
spitting?
You have to take a bite.
Yes. You can take a bite and then spit it out.
It's just cheese. Good job, Connor.
Very nice. You got 2 minions.
Get out. Did he get 2
Ooh.
minions?
You did get 2 minions.
Are you gonna do it again for 2 more?
Nice.
Do it again for 2 more.
2 more.
Well, you only need 2 more.
Mm-hmm.
He hasn't started eating cheese, has he?
Okay.
Very nice.
So a very, like I showed yesterday, I think, a very simple transaction. He takes a bite, he spits it, he gets the reinforcement. He takes another bite, he spits it, he gets the reinforcement. And by the end of this session, actually, and this was just last week, by the end of this session, he ate a chunk of cheese, he ate a chunk of turkey, and he ate a pretzel. And that was the most he had ever consumed for us during a session. So that was exciting. Okay, negative reinforcement. Remember, negative reinforcement will also increase a behavior in the future. And so you have to be careful to not remove the food following the introduction of the less preferred food, because you risk increasing the likelihood of the behavior in the future. Okay, differential reinforcement, the third one, 2 behaviors. You want to increase one behavior, and you want to decrease the other behavior. For example, the parent presents the less preferred food, the child screams, but the parent doesn't remove the food until the child says, "No, I don't want it." And so we end up reinforcing the verbal behavior rather than the screaming. So it looks something like this. The child sees the cookie on the table. He gets into his behavior. Mom gives him the cookie, ensuring that in the future he will engage in this behavior in order to get the cookie. Now, we don't want that, obviously. So our alternative is cookie on the table, screaming same behavior because he sees the cookie, but we want to put that one on extinction. And so what we do is we prompt him to say, "Cookie, please." Communication is reinforced, and he gets the cookie. Right? This is the simple process, and I'm sure as in your daily work, you probably use this principle over and over and over. If you do this type of thing, you are using differential reinforcement. Okay. If you are interested in feeding difficulties at all, you will know that escape extinction is a big deal in behavioral feeding disorders. It is very, very difficult for parents to implement. Let me explain it to you by showing it to you in pictures, because it's the easiest way for me to understand it, so therefore it's the easiest way for me to explain. So, the antecedent is the less preferred food. We get the behavior, and mom says, "I can't deal with this behavior, I'm going to take away the food." Unfortunately, what we've done right here is we have negatively reinforced the behavior. So what we have to do now is we have to put this reinforcement on extinction. We have to say, "No more. I am not getting rid of this food. This child is not getting away with this until he takes a bite of the food." It is almost impossible for parents to do this. Kids have extraordinary ability to stay at the table for hours and hours and hours without interacting with the food. It's always the parent who gives up. So while I'm here saying, yes, escape extinction is an evidence-based practice, it actually is an evidence-based practice that you need to combine with other evidence-based practices that I'm going to talk to you about. One of the other things that we know that works is this idea of systematic desensitization. And if you pair it with the reinforcement strategies that I'm talking about, you can see some really remarkable outcomes. Before I show you this video, let me show you what we use for systematic desensitization. You individualize it for the child. So you probably can tell from the videos that there are pictures in front of the children as you're watching the videos. And so this is something that Joanna and I collaborated on and came up with, and we have improved over time. But this was one of the first ones that we had. And what we did was we took these pictures, we put Velcro in the center, and we created these little arrows so that we could tell the child what the expectation was. Right? So these arrows wouldn't be there. There's only one arrow, but just for the purposes of illustration, you can see that I have lots of them here. As I mentioned, we individualized it for different kids. Here's one that says small bite, big bite. This child has to put it to his face and nose. Other kids don't have to do that. Oops, sorry, I wanted to show you that one. This one is for a child who was ready to take a bite. And so we were moving into, they were able to put the food in, take it out, and then start to take a bite. A small bite all the way up to what we call pop it in. I wonder how that translates into Turkish, right? Pop it in, chew, down, right? So all the way up, and you can negotiate with the child to get them to the point you want them to be at. We also designed one that has no words underneath, because some kids get very hung up on the words, so you have to get rid of the words. Okay, so let me go back to the video now and just show you what that looks like in practice. And you'll see this is the parent implementing this intervention. This is not a therapist. Oh, and once again, no cameras, please. Okay, so here is Michael. You saw Michael yesterday. This is Michael's dad and mom and me, obviously. And so we're working through this, through desensitization. I forget what the food was, to be honest. I can't remember what he was eating, but anyway, here he is.
You can do it, come on.
We're working for monster trucks
Mom,
and fire engines.
We're gonna play with the monster truck and the fire engine, but we gotta work for it. I gotta work for it too.
Oh, let me stop it there for a second. Let me orient you to this. Okay, so see all these things lined up right here? Those are all the reinforcers. Those are all the things that he's working for and there's the arrow that I mentioned, and the pictures are on the table, and so he's working through this process of desensitization for all of these things that are lined up on the table. He gets access to those things for 2 minutes.
Pick up the spoon. Come on, you can do it. Let's go.
Okay, this goes back to what I was saying to you before. What are you going to do if he doesn't? Right? Assuming you don't have all day to kind of say, hey, come on.
Right.
Okay, so the whole point of this exercise is that you get to slide backwards
Okay.
and say, okay, let's just touch it with our fingers. Let's
Okay.
just touch corn with fingers.
All right, touch the corn with your fingers.
Nice
Good
work.
job.
Okay, now remember, touch the face.
All right, bring the corn to your face like I just did. Go ahead,
Perfect.
go ahead. Touch it to your face. Good.
Nice job.
Good job, okay.
Okay,
Good.
keep going
All
till
right.
you need absolute
Now-
resistance.
Now let's go to touch your lips, like this. Go ahead. Good job,
Nice
good
job.
job. All
Yeah,
right,
keep going.
touch your teeth, like this. There
Nice
you
job.
go.
Take it,
There
take
you
it.
go.
Okay, now touch the tongue.
Touch your tongue, bring it right to the tongue, go like this. There you go.
This one.
Get the tongue.
Good
Tongue.
job.
There you go.
Nice job.
Nice
work.
job.
Okay, then in and out. Perfect.
All right, now let's go in and out. Go. Good job. Let's do it again. You did it.
In, close, out.
Watch what Daddy does. In and close. Close it.
You are the
Yes.
best.
All
Nice
right.
job.
Okay, so that's what the process of desensitization looked for one bite. right? So bring your patience. If you really want to do this, be patient. You know, it really is it's a game of waiting out the child. You saw me prompting. You see us using reinforcement. You see us using systematic desensitization. You see me training the parent directly on what it is that he needs to do to get his child to where he wants his child to be. Okay, moving right along. Why is my computer not working? Okay, here we go. Okay, other things that you can do. Use functional, meaningful materials when you're presenting behavioral expectations. Don't make things up. Make sure your pictures are representative of whatever it is that you want the child to do. Show the behavior, or show the learner what the behavior looks like, as you saw me doing, or as you saw Dad doing in that particular video. I don't know why this has stopped working. Use reinforcement, small steps if necessary, attempts to perform the new skill count. Anything at all that looks like eating should be reinforced. You can use response cost if you want to. In other words, taking away something to decrease behavior, but only as part of a bigger system. Use proximity, in other words, be close to the child so that you can prompt the child. And then, as everybody has mentioned as we're going through, keep data. We keep data on every bite during every session. So, you're working to change food intake and mealtime. You're going to do gradual exposure to the less preferred food. You're going to increase interaction and expectation for consumption over time. And so it looks like this. You pick your expectation. You show and tell the child what your expectation is. Then, once you've done that, you ask yourself, did he or she meet your expectation? If the answer is yes, you give him his reinforcer. If the answer is no, you help him meet the expectation by prompting, by using behavioral momentum, by backing up, whatever it is you need to do. If he gets his reinforcer, however, you have to ask yourself, so did he meet the total expectation for today? Has he done it often enough for today? If yes, pat yourself on the back, tell yourself you did a great job, and be done. If no is the answer, pick the next expectation and start again, all the way back up to the top. If no is the answer, you can do several things. You can prompt him. You can go back down in the hierarchy to an easier level. You can pick the next expectation. You do this again with a stronger reinforcer. Go lower on the visual hierarchy. Decrease the number of times you expect the child to be able to do something. You change to another less preferred food. You can pair a bite of preferred and less preferred. And you can do it again, but don't expect him to do it as quickly as he did. And give him more support as you try and work through whatever it is that has been challenging for the child that resulted in no. So I have a minute and 10 seconds left. And my intention had been to share a case study with you, but I actually don't think I should rush through the case study. I think I should probably stop there and maybe just take questions from people during the break time or whatever. Is that okay? Yeah. Okay.